directed to ensure the stable supply of water and electricity during this period. In addition, there will be no disconnection of supply. Furthermore, government will absorb the water bills for all Ghanaians for the next 3 months, i.e. April, May, and June. All water tankers, publicly and privately owned, are also going to be mobilized to ensure the supply of water to all vulnerable communities. Government, in collaboration with the National Board for Small-Scale Industries, business and trade associations, and selected commercial and rural banks, will roll out a soft loan scheme up to a total of 600 million cedis, which will have a 1-year moratorium and 2-year repayment period for micro, small, and medium-scale businesses. Fellow Ghanaians, it is vital that we protect the lives of our frontline health workers who are risking their lives every day to battle this virus. That is why government is placing a high priority on the procurement of personal protective equipment for them. Thus far, 350,000 masks, 558,650 examination gloves, 1,000 reusable goggles, 20,000 coveralls, 7,000 N95 respirators, 500 waterproof gumboots, 2,000 reusable face shields, 2,000 gallons of hand sanitizers, 10,100 milliliter pieces of hand sanitizers, and 500 shoe covers have been sent to the regional health directorates for onward distribution to the district health directorates for use by our health workers in all the districts. That the Minister for Health is ensuring that they reach the health workers. This notwithstanding, government is aware that more needs to be done, especially in the face of the global shortage of PPEs. It is for this reason the government is actively engaged with local manufacturing companies to assist them in the domestic production of PPEs, and I'm encouraged by the response from the Ghanaian private sector. Domestic production of face masks, head covers, surgical scrubs, and gowns will commence from Tuesday. For example, 3,600,000 face masks will be produced domestically with an output of 150,000 per day. I'm equally impressed with the invention of a solar-powered hand-washing sink by Judose from Kumasi, and the COVID-19 prevention electronic bucket made by Kelvin Owusu-Dapa and Richard Boateng, both students of Obuasi Senior High and Technical School. Necessity, indeed, is the mother of invention, as the Ghanaian sense of enterprise and innovation is beginning to be felt. An insurance package with an insurance sum of 350,000 cedis for each health personnel and allied professional at the forefront of the fight has been put in place, with a daily allowance of 150 cedis being paid to contact tracers. Government has also decided that all health workers will not pay taxes on their emoluments for the next 3 months, i.e. April, May, and June. Furthermore, all frontline health workers will receive an additional allowance of 50% of their basic salary per month, i.e. for March, April, May, and June. The March allowance will be paid alongside that of April. The Ministry of Transport is also making available, for free, Ayalolo buses to convey health workers in Accra, Tema, Kumasi, and Kasoa to and from work along specific routes for the entire duration of the restrictions. I'm happy that operators of public transport such as trotros and taxis, are largely adhering to the admonition to observe social distancing in their vehicles. Each one of them should do so. Towards ensuring the cleanliness of our country, especially in the Greater Accra and the Greater Kumasi areas, which are currently the subjects of the restrictions, the Ministry of Sanitation and Water Resources, together with some 400 personnel drawn from the police, military, fire service, and prison service, from Friday, 3rd April to today, Sunday, 5th April, have embarked on desilting our gutters, collection and disposal of garbage from homes, public places, markets, and vehicle terminals. We must ensure that the end of this exercise will lead to a new attitude towards cleanliness in our surroundings. That would be a positive legacy from this crisis. MMDAs outside the areas affected by the restrictions have been directed to emulate this cleanup exercise. As of Saturday, 4th April 2020, markets and lorry terminals in 13 regions have been cleaned and sprayed, with the 3 other regions set to follow in the coming few days. We've had to take the extra step of closing a few markets in Accra and Kumasi, where traders and market women had flouted the rules for social distancing. Some districts have also embraced